Unless you've been living under a rock, you'll be aware that Auckland has a mumps outbreak. There have been numerous other confirmed cases around the country. The media coverage has at least one story a week about the ever-increasing numbers affected and the large numbers of unvaccinated fueling the spread. Recently, this outbreak has been declared an epidemic. The Ministry of Health and medical professionals are urging people to get vaccinated, even if they're up to date. What the Ministry of Health and Immunisation Advisory Council have is a public relations nightmare. And it became their nightmare when 4 fully vaccinated All Blacks contracted mumps. Yes, fully vaccinated. In all of the news reports and interviews with our medical professionals and health authorities, there have been a few things they've failed to tell you about this epidemic and how we got here. You see, in 2010, 2 scientists involved in the testing of the mumps part of Merck's MMR vaccine filed a lawsuit against Merck, claiming they were falsifying data and results regarding the efficacy or effectiveness of the mumps component. Merck had always claimed the 95% efficacy rate, but with no other vaccine manufacturer even coming close to 95% in testing, no one else bothered producing a vaccine, thus creating a monopoly for Merck. In documents obtained under the Official Information Act in October 2017 from the Auckland District Health Board, the percentage of vaccinated children aged 0 to 9 with confirmed mumps was just under 70%. But these kids had received the vaccine, with over 50% of those confirmed cases having multiple doses of the vaccine. Through all of this outbreak, there's been one constant and consistent message from our health officials. It's because of the numbers of unvaccinated people.
Firstly, it's low vaccine coverage.
Some parts of the community are seeing maybe 30, 40, 50, 60% in some pockets who haven't received the vaccine.
So 30, 40, 50, 60% in some cases? Wow, that's a lot. And when a familiar face is repeatedly rolled out by the media in times of a vaccine preventable crisis, you believe and trust those figures are correct. But this is where the bad smell gets a little more funky. Because on sciblogs.co.nz in September 2017, the good doctor writes that we are just shy of the 95% target vaccination rate since 2012. Hang on. She's just gone on TV and told us 30 to 60% are unvaccinated. So Helen, are you just giving us your Keno numbers, or are you making this up as your PR nightmare unfolds?
On top of that, Helen Pertusis-Harris says the mumps component of the MMR vaccine is only 86% effective, and it wears off.
It's sort of in the 10 to 15 years you start to see more cases in the vaccinated. So when you put all of that together, you've got a perfect storm for an outbreak.
There's a lot of vaccinated people out there contracting mumps. And that cannot look good for a government and pharmaceutical funded organisation like IMAC.
Well, so in 2013, I wrote an article about this, and actually nothing has changed. It's the same issue. First of all, there is a paper that shows that memory B cells are inadequately produced by the mumps vaccine when you compare it to measles and rubella. So that's one piece of evidence that indeed there is waning of immunity to the mumps vaccine strain. The second point relating to what Nate was talking about is that the original Gerald Lynn strain is genotype A, and the current strains are genotype G. And in fact, when you do neutralization tests, there are differences, striking differences. So that may also account for the breakthroughs. Now, Ruth mentioned that we don't really have a good correlate of protection for mumps. That is to say, people who are protected in an outbreak generally have higher neutralization titers, but it's not a threshold, and so people with high titers occasionally will get sick. People with low titers may be protected, which suggests that neutralization titers are not the sole correlate of protection. So the question now is, obviously, what do we do about this? Clearly booster immunization is one possibility. The other possibility, which I discussed in the paper, was developing a new mumps vaccine. Now, that's a frightening proposal because, what are you, how are you going to do that? I do think that it could be done. I do think at this state of virology in 2017, we probably could develop a new mumps vaccine, especially since we have an attenuated strain to compare with, and we can sequence viruses, et cetera. However, as I'm sure you all realize, that inserting a new mumps vaccine strain into MMR and the possibility of spending millions of dollars to develop such a vaccine is not an attractive option. But it should be thought about because, as you said, this is an attack on vaccine confidence. And I still think that it would be worthwhile trying to develop a new strain. And if there was success, then we could consider whether or not to spend the money. But anyway, I think there are biological reasons why the vaccine is failing.
Thank you for that.